Hello, everyone. You are live with Jonathan Maness, aka the One-Leg Bandit, CEO, Maness Veteran Medical. And today I have another great partner talk with Image Monitoring USA. And everyone knows Maness Veteran Medical is all about getting life-saving equipment to our veterans, to our DoD. And today is just another notch on the belt of getting these types of products out there. I'm so glad I have the VP of Sales, Mr. Michael Talcott, and Amanda Delk, who is Inside Sales Manager and support at Image Monitoring USA. They're here with us today. So first, I'm going to show you a couple videos, short videos, a minute and a half of two different units, the Falcon and the Dolphin. So just sit back and watch these, and after these, we'll be live with the team.
Advanced Vascular Technologies. Viasonics is proud to introduce the Falcon, the most complete physiologic diagnostic system in the market. Image everything you would expect from a vascular diagnostic system. Fast, simple, complete, effective. Numerous clinical applications to meet all of your diagnostic needs. Quick ABI assessment, crystal clear spectral Doppler, optimal PVR, high-resolution PPG, and numerous other dedicated protocols and examinations. Fully configurable reports, complete network solutions, ideal for all clinical and research purposes. The Falcon is supported by a wide range of state-of-the-art accessories for the benefit of patients and examiners alike. Falcon, designed for you.
And now the Dolphin.
Advanced Vascular Technologies. Viasonics is proud to introduce the Dolphin, the most advanced Tcd system in the market. Everything you would expect from a Tcd system and much more. The cost-effective Dolphin IQ, the ultimate Dolphin 4D standalone system, the ideal battery-operated Dolphin Max. Fast, simple, complete, effective. High-resolution Doppler. Phasic and power M mode. Advanced online and offline processing. Automatic depth detection. Super-friendly user interface. Unique emboli analysis. Remote review stations. Designed for each clinical need and clinical setting. With numerous neuro applications. Brain depth diagnosis. PFO determination. Breath holding test. Emboli detection and much more. Presented in dedicated reports with complete network solutions for all purposes. The Dolphin supports a wide range of probes and accessories for every clinical need. Dolphin, designed for you.
Hello, Amanda and Michael.
Hello, thank you for having us.
Hey, thank you very much for being here. So as you heard in the intro, Maness Veteran Medical's mission has always been the VA and the DoD and getting these top quality products out to them. If you would, again, thank you so much for being here, but let's dive right into it. Tell us a little bit about Image Monitoring USA and what you have going on over there.
Yeah, Image Monitoring USA, we have been in business for over 20 years, and we sell vascular testing systems. We sell transcranial Doppler systems as well as peripheral vascular testing systems.
Beautiful. As well as their accessories for those as well, cuffs and probes, anything that goes along with that equipment.
Well, a lot of things has been taking place in the COVID world now. A lot of people's not able to get in and to the VA, and there's been some ups and downs now, but we're definitely wanting to get this cutting edge technology out there to the VA. So let's talk a little bit about the units, and what the differences are. Let's start first with the Dolphin Tcd. What does that do?
Yep, the Dolphin Tcd system is an exciting unit. Is what we find is that we're very, very getting a lot of business on the Tcd, and it's purely because of COVID that it's helping drive it. Unfortunately, one of the side factors or main factors of COVID is a vascular nature to it. Originally, everyone thought it was primarily a respiratory problem, but now they found it is not primarily respiratory. Yes, so respiratory is involved with it, but it's more involving the vascular system. And what happens in the vascular system is the lungs are typically supposed to get rid of clots that occur in the body, but they're finding that there's so many clots that are being caused by COVID that it's bypassing the natural system to filter it out. And you're having a large number of patients either having cardiac arrest because of clots, lung problems, or stroke. And that's where we come in with the Tcd system, is that we can diagnose patients that are throwing MLI from COVID. The patients that are highest at risk, it seems to be from having a stroke with COVID, are patients that have a PFO. A PFO, patent famum ovum, is a hole between the right and left atrium in the heart. And that hole is supposed to shut when we're born, shortly thereafter. But unfortunately, about 20% of the populace, that never closes up. And so that clot slips through that hole, and then it goes up to the cranium, and that's when a patient can have a stroke from that. And so we're diagnosing that quite frequently.
And, I've had a lot of requests, as from different DoD facilities and VAs asking about this, with COVID going on. And, a lot of people are going to be watching this wondering what the systems do and how to get a hold of you to get these systems. So if the VA had any questions, of course, they can reach out to me at the one-legbandit at Maness Veteran Medical. But how can they get in touch with y'all over there at Image Monitoring?
Yep. Visit our website, www.imagemonitoringusa.com. And there's a little quick little form you can send to us with your questions. And
there's also a chat on our website, so they can chat to us 24/7 directly from our website.
Outstanding. Yeah. And we're definitely going to be driving people there. And in today's stream, I believe we might share the website with you a little bit. We might run through that with you as well. But I want to make sure that everybody has access to image monitoring because, again, a lot of requests has been coming up, and we want to make sure that anybody with any questions today through this video gets some of your questions answered. And the cool thing about image monitoring, they're a true partner. They are willing to do a demonstration in detail for anybody that needs it. We will set this up with Amanda and Michael, and they will be there and walk through every single aspect of both of these machines and how they work and what they do.
Yeah, we do web presentations, I would say average of 4 to 5 a day. The web presentations on the systems, a lot of people love that. And then we also do advanced training for customers that purchase the equipment. Maybe they learned the basics when we were there. They got up and running with our team of trainers. We have a company that we contract with called Flow Consultants that does all of our 2 and 3 day trainings on site, and they're very much in detail training. So when they leave, if you're already performing Tcd or peripheral vascular, then you'll be extremely confident with the equipment. If you're brand new to the technology, then after a 2 day training, you may not be fully comfortable. You'll understand all the basics, but you may want more education, and we provide that remotely, or we can send somebody on site as well. But the remote in service usually gets everybody over that little trend. It's usually just little changes that they want to make to their system and tweaking them.
I understand that completely. And speaking of, just not knowing the system, say there's a VA or a DoD facility out there that doesn't really even know much about what you do. What would be some of the reasons why you would bring this system, the Tcd and the Falcon, into the VA, into the DoD?
Yep. Here, I've got can you share the screen and I'll switch over so they can see actually.
I'll get that done. Yep.
Brochure that we can send out to anybody that you would like.
There you go. We're sharing.
Great. So this is on the Dolphin system. You can see that the cart goes up and down. The the system articulates. It's got an articulating arm on it that swings 180 degrees. The reason we do that is that it's elevated going up and down and articulating, because frequently we're in the patient room where it's not really a good, friendly environment for doing testing. And so it's nice to have the system be as ergonomic and as flexible as possible. The patients that we're testing are patients that have known vasospasm, or we're checking for a patient for vasospasm. Vasospasm is an agitation in the arteries in the cranium. They swell up, and when they swell up, it prevents the brain from actually getting good red blood that it's looking for. And so since it's swelled up and it's not getting the proper nutrients, then of course things can happen to the brain, and that's when we have a stroke. So that's why we want to detect vasospasm, and they will do this test usually over a 15-day period when the patient's in the hospital. We also do HITS detection. HITS detection is very simple. It stands for high intensity transient signal. But that HIT is when you're throwing emboli, which can cause a stroke. And those are patients that have dizzy woozies, or that say, geez, I'm just fuzzy. I'm not feeling right. I'm not able to concentrate, things of that nature. We do HITS detection on that patient, and we can tell you if they're throwing emboli or not. We monitor patients. Let's say a patient comes in and they say, when I am hanging drywall, or when I'm doing a certain position, all of a sudden I feel a little bit of fuzziness. I don't feel quite right. Okay, we can monitor you for 20-minute period, or we can monitor you during a whole surgery for hours to make sure that the technique is proper, that we're maintaining flow, and we're not getting any emboli that can cause strokes on the patient. I mentioned PFO before, patent famum ovum. That is a patient that has the hole between the right and left atrium. And remember, 20% of the populace has that. And frequently, you don't know you have it until you have a stroke. So it's already too late. So if you're getting those lightheadedness when you're exercising, when you're out exerting energy, you may want to have it tested to see if you have a PFO, because you want to find it as quickly as possible, because it can be sealed up. They do have new treatments that they're minimally invasive, and they can seal that up. Vasomotor reactivity. Vasomotor reactivity tells you the amount of vascular reserve that you have in the cranium. So let's say you have a 60% stenosis, but then you also on the front on your common carotid, but then you have one in your vertebrals in the back of the neck. If you have two stenosises, are you really keeping enough flow to the area? And the way we can do that, test that, is with VMR, vasomotor reactivity, or autoregulation. Brain death is another one that we use if we have a patient that is in an accident or has a stroke, and they're, God forbid, they passed on, but they're still alive. Then you want to see if we have brain death, and that's another very popular one.
So this is a very powerful piece of equipment. Before this, what would they have to do to find all these different things? A bunch of different testing. How would they do it?
Yep, a lot more testing. They would have to do CTs and MRIs, and of course, with those, you don't want to do those serially, because you're exposing the patient to significant radiation. With this, there is no radiation, and you can do it on a daily basis. You can monitor for a long period of time without it having any side effects or bad things happening to the patient downstream.
So you can find out in one VA visit, you go to the VA, you hook up to this, you can find out a lot of things about what's going on with your lightheadedness, your blood flow, really pinpoint in. And instead of guessing, a lot of times when you're younger, I know this because I've been through this at the VA, they do what a standard doctor would do. They would just take different approaches and say, I think it's this. This can actually pinpoint in and find out exactly what it is.
Exactly. That's one of the things that we are constantly trying to update people on, is that this can be a one quick diagnosis for you. You can walk in and literally 30 minutes later know that, hey, my dizzy spells are caused because I have a couple of carotid stenoses that combined are causing me not to have enough circulation in my cranium. Or if you have a patient that, they're exercising, they just get winded quickly and they get dizzy. Well, why is that? Well, PFO. It's easy to diagnose. You may wish to have it treated, sealed up, or if it's a small one, you just maybe have pharmacological treatment. But it is quick and easy. I can tell you, numerous stories about people who have gone through various other tests and it was sort of equivocal or not fully diagnosed. They do this, we positively diagnose this, and they're asking us, why wasn't this done first? And quite frankly, it's because a lot of physicians aren't aware of the technology and how it's used.
Beautiful, and we want to get it out there. Amanda, say a VA or DoD facility needs this piece of equipment. How long does it normally take to get it out the door and get it to the VA and DoD?
Yeah, from purchase to delivery, we're about 3 weeks out. And so you can get the system very quickly. And before that, we usually do the virtual presentations. That is very quick to set up. We usually can squeeze you in that week and get all your questions answered for you.
And we have it comes with a training platform, correct? We're not just putting it out there. I mean, we do training and everything, making sure everybody knows how to do everything.
Absolutely, we have a full service training. Every system comes with a 1-day install with your vascular specialist, and then most facilities choose to add on additional training that comes with the CMEs.
Beautiful. So I got to know what's the dummy there in the middle? What is that back there behind y'all?
This guy right here.
All right, this is our Tcd headset, and this is something that you would wear if you were doing a PFO exam. Is what we would do is put this on you. These right here are Dopplers. This guy can come off. This is just for orientation. But what we do is monitor bilaterally, so you would have one on both sides, and we can monitor your MCAs bilaterally, very easy. This takes about 5 minutes to hook up on the patient. And then the studies we perform usually takes anywhere from 5 minutes to a half hour, depending on the series of tests that we do. It's perfectly painless, no invasive. It's non-invasive and very, very easy.
Comfortable padding.
Yeah, nice padding. It just simply sticks on hangs on the cranium. You can crank it down. If it's a patient that perhaps isn't being cooperative, you can crank it way down, but I wouldn't recommend it. You just tighten it up so it stays in place.
From the outside looking in, I'm excited about this. I want to get this into every VA and DoD facility because it can save lives. It can save lives quickly. We're not talking about getting an MRI and spending, $5,000 to $10,000, whatever, every time you come in there. This is something that can be done in a timely manner. Find out what's going on and save lives. And that's, again, the mission.
Yeah, you're looking at a system here that's around $45,000. A patient can come in 30 minutes later after their procedure. They have a diagnosis quickly from the physicians, or it's very easy to diagnose it's not a hard interpretation to do. And then they have a direction of treatment that they can follow, or a treatment plan that's going to happen with the patient. You can't get any more efficient than the Tcd system for all of these diagnoses that we have here.
What are some of the things that go with the Tcd system? So you got the system itself. What's some of the accessories that goes with it?
Yep. So typically you'll have the Transcranial Doppler, which is a little bit of bigger probe than what a regular Physiologic Doppler is. So this is a Tcd Doppler. Yeah, I don't think you can see my screen right now. So you can see
You want me to add the share screen?
Yeah, get rid of the share screen and.
Okay. Oh yeah, we can see you. I can see you live.
Okay, great. So it's what you have right now is this is the Doppler. This is a diagnostic probe, and the diagnostic probe goes on the side of the cranium like so when we're doing freehand. If we're not doing freehand on the patient, then we use the headset that Amanda has. And that headset allows you to put it on the patient, and that stays on the unit. And that's really all the supplies, except for, of course, gel, which you sell, and that's all you really need.
Outstanding. And again, one more time, how long does the test run normally when you're doing it?
Yep, a study can run anywhere from 15 minutes, 5 to 10. Actually, 5 minutes is the shortest that we would do. Like if you're doing a breath holding, unless you have a person that's a professional diver and can hold it for 15. But typically, a breath holding study is 5 minutes. A monitoring study is 20 minutes. A PFO study is about 15 minutes. A typical diagnostic exam, when we're using the probe at various spots around the cranium, that can take about 25 minutes because we're interrogating every vessel in the brain and telling you what's going on there.
And before we move on, I just, from my understanding, what are we looking for when you're doing the Doppler? We're looking at blood flow, and we're looking. What else are we looking for?
That's purely it. We're looking at blood flow and be able to tell whether it's high resistance or low resistance flow. Your brain, because it wants as much blood as it can get, it's a low resistance bed. So meaning that we have certain velocity patterns and velocities that we're looking at to say whether it's normal or abnormal. When we're working with the peripherals, like in the Falcon, doing the arms and legs, that's a high resistance bed. So we expect a totally different waveform. Very easy to know. As soon as you see the pattern, once you're used to it, you can say, oh no, that's a high resistance bed. There's something going on here. We're going into vasospasm. So it's really quite easy, the diagnosis is.
Is there anything else that we need to go over for the TCD before we move on to the Falcon? Anything else you want to put out there about that system?
No, just real quick, there's also new things going on about aortic valve replacement and the high incidence of stroke during the PFO, during the valve replacement and afterwards. Originally, when they were saying that they were putting in the PIG valve or you were doing the TAVR treatment, they were saying that the stroke rate was about half of what it actually is. And the reason they were doing that, they were putting the patients in the study and saying during the period of the stroke and the day after, of the valve replacement, they didn't have any transient events that we knew of. But now that we're monitoring, we're finding out they are having transient events. And that's why a lot of times after they have a valve replaced, they're ended up going to the neurologist a week later, 2 weeks later, a month later. It's because they had these mini strokes. With the TCD, we clean up the mechanism when they're doing it. The doctor gets to see live if they're having any emboli. And then immediate post, we can tell if the patient's throwing any emboli, and then they can give that patient pharmacological treatment to prevent those emboli from happening.
Life-changing technology here. Absolutely outstanding. So before we move on to the next product, everyone, please go to Jonathan Maness YouTube, share and subscribe because we're putting out the good word. We want every VA, every DOD, and every hospital in the country to have this type of technology. You don't need to wait 5 years anymore to get cutting edge technology. We're right here for you. Maness Veteran Medical is a SDVOSB. We are set up, ready to sell this unit and get this unit placed anywhere you might need it. So we're here for you at Maness Veteran Medical, and Image Monitoring is standing by to answer any questions that you might have. So now we're going to move on to the Falcon system. Go ahead, Amanda, and tell us a little bit to start out about the Falcon system, if you don't mind.
Yeah, our Falcon system is our peripheral vascular system. And I will speak about our accessories at first, which are our blood pressure cuffs. They are, what's really nice about them is they are non-porous, easy to clean. They're extremely comfortable for all the patients. Everyone is stating how they're much more comfortable. What's nice is with COVID and all the cleaning of the cuffs and everything like that, you just kind of spray them on in 2 minutes and they're dry. And with the competitors, they are getting wet. And we've actually heard of complaints, which is why we switched over to these, is the competitors are starting to smell because they're having to wash them so much with having to be cleaned. So these are fantastic as far as the accessories. Michael will talk about all the extra details.
One thing that I'd like to mention is the price on the cuffs.
Correct.
The price of our system, of our cuffs, are about a third of our competitors' price. So on the other cups that we used to sell. And the reason that we've been able to lower the prices because we are buying extremely large volumes now. So with the new material and with the pricing, we're finding a lot of people are switching over to our cuffs. Even if they have a competitive product, we have the cuff to meet the competitive product, and people are buying, literally a dozen cuffs at a time from us. Some of the aspects of the Dolphin, let me go back to sharing our screen, the Falcon, and I will just review that real quick with us, and click on that and share.
All right, it's added.
All right, so now we're going to switch over. I think I've got there's the Falcon.
It should be right there.
Yeah. There's the Falcon. The Falcon is a different technology. You have a lot of different moving components with the system I shouldn't say moving, they're all digital, so they're not really moving, but what you have is 10 pumps with a system. So you have 10 hoses and 10 pumps. That's very unique. All the other systems in the market have 1 or 2 pumps. We have 10. They're ultra quiet. That's valuable as well. There's nothing worse than the loud sound of a pump turning on to a person that's getting it done. It drives them nuts. Ours are quiet. You really have to try to listen to hear it. So that's one of the things that we improved on our system compared to others. Plus, we have what's called spectral Doppler and PPG, photoplethysmography. So it's a really well-rounded system. The patients that we're looking at doing, or the studies that we would like to do on this, are studies like reactive hyperemia. That's going to tell us if a patient has peripheral vascular disease in the lower extremities. Palmar arch exam. Palmar arch exam tells us whether the patient has a patent palmar arch. So if you're doing any patients where you're doing radial access or radial harvest for heart surgery or heart cath, you really need to do a palmar arch exam beforehand, because that'll tell you if the patient's at risk. If that radial gets damaged, tells you if that patient's at risk for losing or having poor circulation afterwards. We do a lot of work with diabetics. Diabetics, as you know, have PAD, they get ulcers. And when they have an ulcer, we really have to get proactive and be able to monitor and treat that. So the best way to do it is do preventive. All diabetics should have, at least by the age of 50, a basic ABI done. That's one of the studies we do with the system. An ABI with a waveform will tell us whether the patient is at risk for PAD, and that way we can get very proactive and prevent them from ever having an ulcer. Hopefully, that's our goal. Or once they've been diagnosed, maybe they have severe PAD, maybe we didn't test it early enough, then we can also track that patient and set out game plan on how to treat the patient from that basic study that we did. These exams are quick. They take anywhere from 15 minutes to 30 minutes. They are preventive as well as post after a patient's been diagnosed with it. Typical system in a VA is used all day long. Sometimes it's 2 shifts. Sometimes they'll start at 7 and they'll end up finishing the last shift up at 11 o'clock in their vascular lab. These are workhorses. They are used like crazy in vascular labs. Every lab should have a Falcon. Every vascular lab should have a Falcon.
Well, we definitely are going to get it out there. You know, the VA has a lot of diabetic community. You know, it's just something, it's definitely rampant at long-term care facilities. You know, a lot of people are dealing with ulcers and things of that matter. So again, we've got to get as many of these out there as we possibly can. So what are some other things you'd like to go over about the Falcon system here?
Well, one thing I'd like to mention about the Falcon and the Dolphin that I haven't really gone into, we do go into the VA PAC system for the doctor, for your facilities. So whether they're on Vista or any other program that they're on for their DICOM and PAC system, we can communicate with that. So both systems will go directly into your PACs. We have workless modality for us to be able to pull the patient information. We can either pull that from HL7 or from the PACs, and then we can also send it back to the PACs as DICOM or DICOM SR for structured reporting, or HL7 for like an EMR environment. One of the things that really makes us unique as well, not only our DICOM SR in a communication, but we also have remote reader stations for both the Physiologic and TCD. So if you have a physician that really wants to get involved in the reporting process and do post-editing, we have that covered for you as well. We're the only company on the market that is that in depth for your connectivities on everything.
Yeah, and that's very important. You know, when you get into a VA, there's a lot of little check marks, that's, especially with equipment like this, that you have to check off the boxes, and we already check off the boxes for all the VA and DODs out there. So the Image Monitoring USA is good to go and ready for the Falcon and for the Dolphin for those systems.
One other thing I'd like to mention about the Falcon that's very unique about our system, we also use pictures in it as well. You can see a picture there where it's showing the cup being wrapped, but typically I use the pictures for taking pictures of the ulcers or the toes. One of the problems you have in most labs is that a lot of times the vascular surgeon hasn't seen the patient yet before a physiologic exam is ordered. So when he gets that exam or she gets the exam, they're assessing just the report and they aren't able to assess the patient personally. Well, one thing that we felt was needed was the ability for the physician to truly assess the ulcer or the extremities without being there. So like you and I were talking about earlier, where you're doing a lot of things via the web now, where they're talking with you and you're doing patient visits. This way, this allows the physician to get an overall view of the extremities of an ulcer, of digits, before he meets with the patient, because he may not be able to meet with the patient right away. And that way he can get really, or she can get very proactive with the patient.
Very intriguing there. Let's talk about this a minute. So what you're saying here is we can get these in all the outpatient clinics, all the small little facilities. Then the doctors at the VAs can be double effective because they can technically see what's going on without even being there, pretty much.
Exactly.
Correct.
Yep, exactly. We can do movie mode if there was something that we wanted to do movie mode with. Typically, that may be TOS, thoracic outlet testing, or could be a TCD exam, looking at a patient for cognitive responses. But the one that really everybody's sitting on really aggressive is the pictures. You know, to see those toes, those ulcers, those extremities, and assess them remotely.
Beautiful. Well, I want to give you the floor. We have all the time in the world. Is there anything else that you'd like to go over about maybe what's going on in the future with image monitoring, or anything else as far as a message to get out to the VA and to the DoD and anybody that's watching today?
I sure would. Another new device that we just came out with, I don't have it here because it's that new. We are just FDA approved. It's our new headgear for the TCD. We have a new robotic headgear that you can put it on the patient. It looks sort of like what wrestlers wear, that little piece that they put on to protect their ears.
Yeah,
it looks very similar to that, only instead of being over their ears, it's in front of it in your temporal window. You slip that on the patient, and then within 30 seconds, you can find both bilateral MCAs. If you want a very fine-tuned mapping of the MCA, then it takes 2 minutes, but it does that automatically for you. So if you have a patient that's coming in with potential stroke and you want to see if there's something going on intracranially, you can know that within 2 minutes on that patient.
And everybody knows that when it comes to stroke, it's fast. You got to get to it immediately. Every second counts with a stroke, and this will save a lot of time.
Exactly. Before it's sort of, you got to wait to try to get them to a CT, MRI, or you're trying to assess with an ultrasound. The technologist is trying to find it. I guarantee you within two minutes, we can find it on over 80% of the patients.
So what we've hit here, everybody that's listening, we need this in every ER at the VA and DoD. We need this in outpatient clinics, and we need this in every VA facility, healthcare facility. I am going to fight tirelessly until we ensure that we have them out there, because I'm all about the veterans. I know by my work every day that we can have this cutting edge technology and we don't have to wait. So Maness Veteran Medical is here for you. Image monitoring is here. All you got to do is reach out. We're going to do a lot of demos next week and the week after. We're here for you. So just reach out and send that email, and we'll be right there to you. So we've been at about 35 minutes here. Anything else y'all want to touch on?
No, I think I'm good.
I think we're good.
Well, I tell you, I greatly appreciate you, and the veterans appreciate you. I'm speaking for them, but we are all on the same mission. By great partnerships, we're able to get these products out there, and I just want to say thank you from Maness Veteran Medical and from my fellow veterans. Okay.
Thank you very much. We appreciate you. We appreciate the veterans immensely, and anything that we can do to help, we're here. We love improving and saving lives.
Well, I hope you have a wonderful day today. Thank you.
Thank you. You as well. Take care, John.
Thank you. So everyone, that was Image Monitoring USA, and I'm so blessed to have great partners like that. They are standing by, any demonstration that needs to be done. Don't wait. Email us today. We will set this up for next week, and they will do a complete demonstration. Just wonderful people over there. So again, to all my VA and DoD that's listening out there, please share this. It may not directly affect your department, but it definitely affects the veterans that are out there. There's been times already in my life, I'm 38 years old. I have been to the ER at the VA, and if they would have put me on this, I think we would have gotten to things much quicker. They've done CAT scans on me, and found different things, but I think some of my problems could have been this. And I know that because I was feeling lightheaded every time that I went to the ER, and still never got to the bottom of it. And I guarantee you something like this could have definitely told me exactly what's going on. And that's what we're wanting to do. We want to get to exactly what's going on with the veterans and fix them to the best of our ability. So Maness Veteran Medical just we love what we're doing every day. And me and my team, we are working hard every day to complete our mission. And I tell people I stay in my lane. My lane is VA, DOD, federal contracting, state contracting. That's my lane. That's what I'm good at. I've helped procure over $1 billion for my clients in the last 12 years. I know what I'm doing. I read. I dig into what needs to be done, and I'm here for you. So anybody that's out there that's trying to get your products to the VA and to the DOD, let me know about it. We'll vet it, and if we think that the VA wants to know about it, we will get you out there. So thank you, everybody. Look, it's Friday. Thank goodness. We're going to have a good weekend. Tom Brady's going to go down there and win the Super Bowl. Hopefully, that's who I'm pulling for. Everybody already knows that. I am doing a football talk tomorrow at 12, sometime between 12 and 2, just breaking down the Super Bowl. I do that to kind of clear my brain, get off of work for a little bit. And believe it or not, I've had thousands and thousands of views on my football videos. So I enjoy it. I appreciate everybody and look forward to next week. We got Yan Caddy next week. We got a couple other partners coming. And also I'm going to do a couple talks next week about helping small businesses grow. Been doing such a good job since January the 1st with this first stimulus check challenge video I put out there. We're already helping 50 people, having a couple more today, and just so happy to see these small businesses grow. So if you have any federal contracting questions, I am here for you. So everybody out there, the One Leg Bandit is out, and email me any questions that you might have for next week. Thank you.